thank you very much for coming to this meeting. I have asked residents prior to this meeting to submit their questions. We have in excess of 30 questions. Some of them are duplicate, and we have basically consolidated them to about 20. I will also encourage you, if you have additional questions, to basically put them in the chat line so that we could hear your questions and then attempt to address them. One of the most pressing issues on the minds of my constituents is the fact that there is a tremendous amount of confusion surrounding the COVID-19 vaccination rollout. They are, in fact, hearing conflicting messages about who is eligible to get vaccinated, which vaccines are safe, and where they should go to get them. They're also very angry that less prosperous, disadvantaged neighborhoods where COVID-19 risks are higher, that these neighborhoods continue to be underserved by the vaccination program. There is a general belief that Ontario's decentralized vaccination rollout is too complicated and is deeply flawed. These are some of the points that my residents have been making to me. The province is responsible to distribute the vaccines acquired from the federal government to municipalities. The city is responsible responsibility is to administer the vaccines. To do this, Toronto has established its own scalable network of vaccination clinics with appointments available through the provincial booking system. The provincial portal, this system works extremely well until, of course, the vaccine supplies run out, which unfortunately has been frequently for many people. The city's various hospital networks, health networks, also have their own separate rollout program. They have set up everything from mass clinics to small local clinics, pop-up clinics, and mobile clinics, which mostly brings vaccines to our seniors. The hospital have also established their own vaccination rules and booking systems. And there's no apparent unified citywide strategy and or message amongst the hospitals. Needless to say, residents are confused over who is eligible and whether they can just simply drop in or should they book an appointment first. They are very frustrated and angry when they stand in line for hours, only to learn that their clinic has ran out of vaccines and they can't get their shot. Adding to the confusion is the rollout through pharmacies, other rules, other booking strategies, and unreliable vaccine supply chain. It seems that there is no coherent, consistent, and coordinated provincial vaccination strategy. In the public mind, there are too many separate vaccination streams with different booking systems and vaccine brands operating under different rules. And that is leading to increasing frustration, a loss of public confidence in the system, and of course, growing vaccine hesitancy. Our special guest tonight is Chief Matt Pegg. Matt's real job is Chief of Toronto's Fire Service. And because of the enormous challenges created by the pandemic, he has been appointed by the city to lead the Immunization Task Force Command Team and served as General Manager of Emergency Management. Matt has been working nonstop, it seems like an eternity, but for the last 13 to 15 months, Matt has a tremendous amount of energy, poise, and a tremendous amount of calm. And as I said to him earlier on, he looks much more youthful. And I think that the hours that he's putting in is obviously doing great service to you, Matt. Not that you didn't look fantastic before, just that the hours and that you're putting in. So I want to thank you for that. I want to make it very clear, though, that Chief Pegg and his extraordinary team are doing an amazing job under very difficult circumstances. When the province has delivered enough vaccines, the city's vaccination centers have been exceptionally efficient in putting needles in arms. And that is essentially what we want to see happen. Our residents want to get the needles in their arms so that they're protected from the COVID virus and obviously the variants and so on. They're very concerned about getting the needles to protect themselves and protect their families and to ensure that they can get back to a normal of life as much as possible. Most of the problems associated with the vaccine rolled out, in fact, are beyond the City of Toronto's control. Those that fall under our control continue to be dealt with immediately. We have a system in place that is efficient, that is scalable, that is meant to get the vaccine into the arms of our residents as quickly as possible. It is my great pleasure to welcome Chief Pegg to our town hall meeting. We have a number of questions and we'll get to those in a moment. But Chief, I would like to just give you a few minutes just to do some opening remarks. And again, thank you so much for being part of our town hall meeting this evening.
Well, Deputy Mayor Thompson and ladies and gentlemen, thank you very much. And I really appreciate the opportunity to join you and the invitation to be with you this evening. As Deputy Mayor Thompson, as you indicated, this has been a unique challenge for us as a city, and certainly for me individually. As the Deputy Mayor indicated, my profession, so to speak, is that of Fire Chief in the City of Toronto and the General Manager of Emergency Management. And it was in that capacity that more than a year ago, I was asked to take on the responsibility of serving as what we refer to as the incident commander for COVID-19 operations in the city. And what that means is that the skills and the experience that I bring to the team is really in the setup and the operation of what we refer to as an incident management system. And you may be interested to know, you may have heard us say this before, that the systems and the processes that your city has used and relied upon to navigate through the entire COVID-19 pandemic and to respond to all of the various waves and twists and turns that have happened are exactly the same processes that happen on the scene of emergencies every day and inside our mobile command posts. So my specific expertise is in incident response and incident management, and it's really with that background that I have joined Dr. Davila and the Toronto Public Health team and all of our members of council and our fantastic Toronto Public Service team in response. It's been a long haul, and as Deputy Mayor Thompson indicated, I know that we're all tired. I have a deep appreciation for the extent to which I'm sure every one of you is fatigued and frustrated and very much ready for this to be behind us and over, and I can assure you that I am as well. We are literally working day and night, doing everything that we can do to make sure that we are as responsive as possible and really now focused primarily on making sure that we can roll out vaccine as very quickly as possible. And anyways, I look forward to, I know Deputy Mayor, I know you have a number of questions. The Deputy Mayor will tell you that I tend to be very candid, and I will continue that tradition. I am not a medical doctor. Like I said, I am the fire chief, but I have had the privilege of working alongside Dr. Davila now for a year, and I look forward, sir, to doing my very best to respond to your questions tonight. Thank you.
Thank you very much, Matt. And I know that you're a quick study and that you have been able to answer so many questions on some of the calls that you and I have been on. Let me start with the first question, and it really deals with rollout. And the first question is, what's the current status of the city's vaccine rollout program?
Sure, great question. So, and a rather complicated answer. So, in essence, there is a multifaceted rollout that has now been underway for a number of weeks and a number of months, and it involves, as Deputy Mayor Thompson, as you indicated, I think we'll start with just laying out the framework. The Government of Canada is responsible for approving vaccine and then acquiring all of the vaccine for the country. So they approve it, they buy it, then they provide it to the province of Ontario. The province of Ontario then allocates the vaccine across the province, including to the city of Toronto. It is apportioned out, and then they deliver it to us. They also determine what is known as the prioritization or eligibility for vaccine. So it is the province of Ontario that determines who is eligible to receive vaccine and in what order and in what priority. And then those instructions are provided to us locally along with a certain quantity of vaccine. So let me just break this into its pieces. The city of Toronto itself, our city, operates a network of 9 what we call mass immunization or vaccination clinics across the city. That is the backbone of our vaccine program in the city, but it is certainly not the entire program. So in addition to the 9 sites that happen across Toronto, of course, 2 of them local, for yourself, Deputy Mayor, at the Scarborough Town Centre and Malvern Community Recreation Centre, there are 7 others across the city. We work hand in glove with all of the hospitals, so our hospital partners across Toronto, with the Ontario Ministry of Health, with the Ontario Health Teams, and with all of the various community health agencies and health partners that operate in the city every day. So there's a very big machine and a very big engine that is rolling out. So I can tell you that today, for example, there were 27 different clinics in operation today. 9 of those are the city-operated clinics. 18 others are operated by hospital and healthcare partners, in addition to a very, very wide number of pharmacies and an increasing number of family doctors, primary care physicians that are administering vaccine. So by numbers, you may be interested to know, as of yesterday, as of last night, we have administered 977,000, just over 977,000 doses of COVID-19 vaccine in our city. 29,000 of those were administered yesterday alone. So that's great. We have a lot to be proud of, but frankly, we have a long way to go yet. And that's why we're continuing to work every day. It is that partnership approach, some happening in our city clinics, many happening by our hospital partner clinics, many more yet happening in pharmacies and primary care family physician offices around the city. So very much an ongoing. We just recently learned that certain Shoppers Drug Marts are now moving to 24-hour service as well. So You'll see that continue. It will continue to expand as additional vaccine becomes available. That's the last thing I should say, sir, on this is we scale, all of those operations are scaled directly based on the amount of vaccine that is available to us. And you may find it interesting that the 9 city-operated clinics, we're only administering a small portion of what we're capable of delivering. So we have far more capacity in our clinics than we're actually delivering today. The only reason for that is we're simply delivering the vaccine we have. We need more vaccine.
And thank you very much for that, Matt. And it's funny that you say that we need more vaccine, because the next question is, when will we have enough vaccine supplies to vaccinate everyone? And while you may not be able to give us a full answer, I wonder if you could maybe just touch on that a little bit in terms of what you know about the process right now. I know the federal government and the Prime Minister continues to tell us how many vaccines that he has ordered, but the question is, when will they come for us here in Toronto and, of course, across the country?
Yeah, great question. And quite frankly, this is a question I would love to know the answer to myself. Right. We really only get accurate visibility on vaccine in about 1 to 2 week increments. So we're seeing, of course, we're reliant on the province of Ontario. What we get from them is a delivery schedule for the various vaccines, and we only really have reliable information about a week out. We get a forecast from them that goes 2 or 3, sometimes 4 weeks out. And let me just talk a little bit about the vaccines. Right now, there are a number of vaccines that are approved and being administered. Pfizer is one of the vaccines. Pfizer is what is administered in the 9 city-operated clinics. So we use Pfizer. There are logistical reasons for that. Pfizer vaccine requires very comprehensive, it requires very cold freezers, cryogenic freezers. So we have those. So at Pfizer in our clinics, Moderna is the second vaccine. It is provided directly by the province to our hospital partners, and that is principally, they'll administer Pfizer as well, but Pfizer and Moderna administered by hospitals. AstraZeneca is another great vaccine, one of the approved vaccines. It is available in pharmacies and in primary care physician offices. So unfortunately, that is the question we're all waiting for, is when are we going to have enough? I said we're seeing this. We see reliable information on about 7-day cycles. So very complicated thing for us to manage across our network of clinics and for our hospital partners as well.
Sure. So we've heard obviously people saying that they want a specific vaccine, and I know that you and Dr. Davila would advise people to basically get the vaccine that they have access to. Would that be your continued advice to the residents in Scarborough Centre?
It absolutely is, sir. All of the vaccines that are available to us have all been thoroughly tested and approved by Health Canada. And all of the vaccines that are administered and are available to us here are all approved, and they're all safe. And the best advice that Dr. Davila, our medical officer of health, gives day and night is, her best advice is, the best vaccine is the first one that you can get, and the first one you can get access to, and the first one that you can receive. I can tell you that we have a number of, I know a broad spectrum of people now that have received Pfizer and Moderna and AstraZeneca, and again, no issues. They're all safe. They're all great choices. They all provide excellent protection against the consequences of COVID-19. And I can tell you personally, I have no hesitation on any of them.
Thank you. Chief, there has been obviously concerns by residents in Scarborough. We know that last week, the SHN Scarborough Hospital Network canceled a number of their mass vaccine clinics, and the reason for that was insufficient vaccines. Yet it appears that there were vaccines available to provide for the pop-up clinics, because there's a number that they've introduced even just this week here, the one that started today, one's tomorrow, one's Saturday. I'm not going to ask you to speak for the SHN, but I'm going to ask you to maybe just comment in terms of your thoughts on the idea around clinics taking appointments and not having enough vaccines. That sounds counterintuitive to the interests of the program that you're trying to run and what we're doing in the city. What advice would you suggest to folks? I mean, it is just simply just wait till we get enough vaccine and we will ensure that you get back on you're not going to be removed from the list. I'm sure the SHN will follow up to be able to call people to let them know that they can actually come for their vaccine. What's your thoughts there? Sure.
So, I mean, obviously that I was so disappointed when we learned of the shortage, and we watched and learned that the Scarborough Health Network was in a position where they were going to have to cancel a significant number of appointments, and that's the opposite of what we ever want to see happen. The reality is that that is the direct result of a shipment, a series of shipments of vaccine that simply did not arrive. And it's important that we work every single day with our hospital partners, including Scarborough Health Network. They are fantastic partners. They are dedicated, intelligent, very committed people who are working day and night to administer vaccines. Unfortunately, what happened in that circumstance, we were all of the province was expecting a very significant shipment, a regular shipment of Moderna vaccine. Moderna is supplied to Ontario once every 2 weeks. So many clinics, including Scarborough Health Network, booked appointments based on what had been forecasted to arrive and what all of us believed was going to arrive. Unfortunately, Moderna, the company Moderna, on their end, failed to, for whatever reason, were unable to supply those vaccines. And of course, that resulted in the Scarborough Health Network being in a situation where they had thousands of appointments booked, expecting vaccine to arrive that did not arrive. So a number of things happened behind the scenes. Obviously, there simply isn't enough vaccine system-wide for anyone to make up that loss. I can tell you from a city network perspective, we we immediately went to work and did everything. We identified every dose that we could pull out of somewhere else, and it was transferred. There were significant quantities of doses of vaccine were transferred over to Scarborough, but unfortunately, there was not enough to make up that shortfall, and they were in a position to cancel. So, what I can say, sir, is that Scarborough Health, they operate a very similar system to what's operated in Toronto, in our city operated clinics. We book appointments based on the forecasted availability of vaccine, but of course we are dependent on the province of Ontario and the government of Canada to deliver it to us. So we're really right now, we're actually in the hardest part, where Dr. Davila called it this morning, in the vaccine valley. So we're in the valley right now, very limited availability. We got to get through about the next week and a half. And then beginning about a week and a half from now, we're expecting significantly increased doses of vaccine to arrive in our city, which is going to allow us to expand. So I wish I could have prevented that. We didn't know. We're entirely dependent on the supply chain. And, you know, I can certainly say, sir, on behalf of all of us that are involved in anything to do with immunization, you know, obviously I don't represent Scarborough Health Network, but I can say I'm sorry on behalf of us all, because every one of us did everything we could do to prevent that and respond to it when it happened.
Thank you. I appreciate that, Chief. I know that there's a lot of activities that's taking place between some of the businesses in the city and trying to work with the local hospital networks in terms of providing vaccination facilities on their sites and so on. Can you speak a little bit about that? I have someone who will be coming on in a moment. They're talking about what their company is doing in conjunction with respect to the Scarborough Hospital Network. What's the messaging there? How do you see that actually playing a role to ensure that we get more people vaccinated, especially those workers who are working frontline and who are vulnerable? And so is this part of the strategy for the City of Toronto to ensure that we incorporate these component parts to ensure we can get more needles in arms?
Yeah, it certainly is part of the strategy, and, you know, albeit a very complicated thing to coordinate and manage. So again, difficult to explain on a provincial context, but you may be familiar, I know you are, sir, but many may be familiar with a term or an institution known as the Local Health Integration Networks, or the LHINs. That is yes. Right, so that is a coordinating body established by the province of Ontario that provides coordination and strategy around healthcare across the city and in fact across the province. The local health integration networks, in collaboration with a group of folks that include hospital teams and Ontario health teams, they receive the same prioritization the City of Toronto receives. So that is the province of Ontario saying, here is the priority for who should get vaccine. You know, as we know, some of it is by age, some of it is now by geography or postal code. So they take that, and then those local health integration networks, in partnership with hospitals, reach out and on a local basis determine what the best community-based response for rolling those specific clinic opportunities are. And I think that's an important thing to have happen, because these are folks that are on the ground in the respective communities, that understand the community, understand the network of businesses and the network of residents, and are responding directly to those needs. So that is happening across the city at all points in time. The City of Toronto proper, my team, what we call our immunization task force, we do not operate or coordinate or control those the local health integrations or the mobile or pop-up clinics. Those are operated principally by hospital and health team partners. We operate, the City of Toronto operates the network, that backbone network of 9 fixed sites.
Excellent. Well, we have a guest with us. Jocelyn Bamford is with us from Automatic Coding, and she is a business person in the community that's working with the SHN. Jocelyn, I'm going to open up the mic for you to maybe just to give us an overview and tell us how you're working with the SHN in order to ensure that your workers are vaccinated and so on. Can you tell us a little bit about your experience? And welcome.
Yes, thank you. Thanks for having me. We're working both with this SHN and Michael's or Councillor Thompson's economic development group to identify hubs. And we've identified a bunch of industrial hubs around Scarborough. And we are identifying the companies in the hubs and the number of employees in the hubs. And our strategy is, I mean, we're almost there. We just need some vaccines. We're ready to roll them out. Is to have a day where manufacturers, local manufacturers in the area, are able to shepherd their folks in to get vaccinated, and capturing what I think is really important in this strategy is temporary workers. Many manufacturing plants have temporary workers because they'll have a surge day, one day that they'll have extra production required. And so they'll bring in temporary workers. And just like we saw with the LTC workers, those temporary workers will go from plant to plant to plant. Some of them are students, some of them work 1 or 2 days because that's what can fit in their schedule. But they are mobile. And so we really need to make sure that we vaccinate those folks as well. So we're trying to identify that vaccine day where we get temporary workers and capture them in and amongst our other workers. So I think we've got a good plan. Scarborough Health Network's been fantastic. Michael, or Deputy Mayor Thompson, your team's been fantastic in identifying the major manufacturers. And we've gone from, you know, the knowledge of us knowing which businesses are big in our community and identifying and getting them out. They're all gung-ho, ready to go. All we need is some vaccines to get in their arms. And I think this can be really positive about making sure that we see tamping down. I mean, we've spent, a lot of manufacturers have spent a ton of money investing in PPE, in changing our workflow, and providing, you know, in our lunchrooms, making sure that we have cubicles. There's been a lot of investment, technology that takes temperatures coming in and records, doing rapid testing, all of these things we've done, but critical to getting back to normalcy, or as much normalcy as we can, and continue to keep the production flowing. I mean, a lot of people are saying, well, why don't we shut manufacturing down? Well, you shut manufacturing down, you know, it affects everything from the medicines that come to the hospitals. They need, you know, if you think of a Tylenol bottle, it needs a plastic cap, it needs a plastic bottle, it needs a skid that you put the product on. There's so many components in the supply chain. So it's critical that we keep production up, manufacturing going, and we get vaccines in arms so we can stop the rise in COVID cases in these hubs. So that's what we're doing.
Thank you so much, Jocelyn, for that clarity. It's very helpful. Thank you so much. Matt, I wanted just to turn back to you for a second. We have a question that came in through the chat, and the question basically asks, there are 2 locations in Scarborough that's operated by the City of Toronto. Can I go to any of the other 7 locations across the city to book an appointment?
Yeah, great question. And in fact, yes, you absolutely can. So the City of Toronto, the 9 City of Toronto vaccine clinics operate on what is known as the provincial booking system. So we are clients, if you will, of the Government of Ontario's booking system. And that means a couple of things. That means that if you are eligible to receive vaccine in a city operated clinic, you actually can book your appointment in the clinic of your choice on the day and time of your choice. And that actually applies across the network, right across the province, for anyone that is on that booking. Yes, most people choose to book in the clinic closest to where they live, but you are absolutely able to book into any available appointment in any available clinic on the provincial booking system.
Thank you for that, Matt. There's a question that has also come up through the chat, and it's basically how will people be notified, or how will communities be notified of their local vaccine pop-up in their areas and when it becomes available? I can take a stab at that to begin with, Matt, and then you can add to it, because obviously working with the SHN, a lot of the work that they're doing is trying to put these pop-ups. And I know that some of my residents have asked me about M1P and M1R, when those vaccines those pop-up clinics will be made available so that they can get vaccines and so on. I don't have those dates yet because the SHN will make that determination. They will promote it. They will let people know in the area where they're going to be at the appropriate time. Those are some of the things that we're working on. There's a thematic message that's coming through this conversation that I'm having with Chief Pegg, and that is, and Jocelyn just touched on it as well, Chief, the fact of the matter is that we are ready to go. We're ramped up. We're amped, ready to put needles in people's arms. What we don't have is sufficient vaccine in order to do that. It is not a structural problem that we have. It's a supply problem with respect to having the vaccine. So I don't know if you wanted to add anything to that, Chief.
You are absolutely right, sir. I actually listened to Mayor Tory earlier this week refer to this or answer this question in one of the press conferences, and I thought he did a fabulous job. So I'm going to shamelessly steal his answer. He explained that this is a situation where it's not about giving work or arguing, if you will, over the various slices of the pie. The issue is that we don't have a big enough pie. We need more vaccine en masse, and we are capable of administering far more vaccine every day than today we have available to us. The exciting part, and what I'm excited about, is the forecasts certainly our expectation is that in only a week and a half, beginning say less than 2 weeks from now, we are expecting to see that turn up. And we're expecting to see very significant increases in the amount of vaccine that's provided. And that will allow us instantaneously to also increase rollout. And that includes increasing the capacity within the city-operated clinics, but also providing very significant increased amounts of vaccine, or the province, I should clarify, the province will provide increased amounts of vaccine to all of our hospital partners, so that across the board, enterprise-wide, we'll see far more people have the opportunity to be vaccinated much faster.
Right, and that's terrific. Chief, I wanted to ask this question. It's one of the ones that was submitted some time ago. The question is, if I get the AstraZeneca vaccine, can I take as my first dose? Can I take a second dose of Pfizer? Do you know whether or not there is a relationship, or is it problematic if we were to take a second dose that's different from the first dosage of the vaccine?
Yeah. So what I'll answer within the zone of what I know, sir. So
sure,
I can confirm that all three of the vaccines that are available today, Pfizer, Moderna, and AstraZeneca, all three of those are what is known as a two-dose regime vaccine. So that means the vaccination program requires 2 doses, and those 2 doses are to be of the same type. So if the first dose of vaccine you received was AstraZeneca, you will receive a second dose of AstraZeneca. Likewise, if your first dose was Pfizer, you'll receive a second dose of Pfizer. With respect to at a future point, can you cross? I frankly don't know the answer to that. That would be a question that one of the medical doctors would need to ask. But we are planning. So I'll give you as an example, our city-operated clinic. When someone books an appointment in one of the 9 city-operated clinics for their first dose, at the same time you book your first dose, you will also be booked to receive your second dose. So you will have an appointment for your first dose, you will receive it, and then you'll come back and receive your second dose. That is the same process in the rest of the clinics. I do know that there are certain circumstances where folks may have received their first dose of vaccine, and this seems to be more common in the pharmacies, where they may have received their first dose of vaccine and have yet to receive or get their appointment for their second dose. The best advice I can give is to be in contact with whatever location you received your first dose. So for example, if you received your first dose of AstraZeneca in the Shoppers Drug Mart closest to your home, and you haven't received your appointment, I would get in touch with that specific Shoppers Drug Mart to schedule your second dose. But ultimately it will happen. There's a dosing interval. The amount of time between the vaccines has been directed and approved by Health Canada and the National Advisory Committee on Immunization. They provide those instructions to the province, and that's what determines that dose interval.
Thank you. And just following on that, Chief, the next question is, how can constituents be assured that waiting 4 months between the first dosage and the second dosage is effective? And they use an example, Pfizer, the first dose may be 62% effective, but how long do you have to wait? And the second dose may be 95% effective. But if you're waiting, that is according to the manufacturer's description in terms of how you use the vaccine and how to appropriately utilize it according to their instruction. But if you wait for the 4-month period, do you know what the effectiveness is and whether or not it is as effective as it should be based on the needs to ensure that one is protected to the 95% or the 85% degree that one would want from using the specific vaccine?
Sure. So the way that this has been explained to me by Dr. Davila is, and I will do my best to recite her words of wisdom. So first and foremost, that amount of time, that interval between the first and the second dose, is something that those are decisions that have been made following medical and scientific evaluation by the National Advisory Committee on Immunization and by Health Canada. So I can tell you, for me, I feel very confident. I have received my first, just on Sunday, I received my first dose of vaccine. I feel very confident in the fact that my second dose is scheduled, or I don't actually have a date for it yet, but it'll be scheduled in about the next, 4 months or so. With respect to how it works, and Dr. Davila answered this question, I listened to her answer it yesterday. So here's what I found really informative and is important to me. It is not a situation of it wearing off. The second dose isn't about, not lasting as long. The second dose of vaccine is about the amount or the length of time, so to speak, for which the vaccination or the immunization will be present in our system. So again, I'm gonna hold off, Deputy Mayor. I won't cross the line into attempting to play medical doctor that I'm not. But here's what I do know: there is a very, very significant amount of protection that our bodies build somewhere around day 10 through day 14 after we receive our first shot. We start to build those antibodies. And that means that even after the first shot of vaccine, we are afforded a very, very significant amount of protection. The immunization process is completed once we have received our second dose of vaccine. There are vaccines in the system that are being evaluated by Health Canada that are single dose. So the day may come where we may see one of those is Johnson & Johnson. You may have heard of that being tested. So we may get to the day when there's a single dose. Right now it is a 2-dose regime, and the medical scientists and doctors have assured all of us, me included, that it is absolutely safe to wait that amount of time, and that we're afforded a very, very significant amount of protection.
Thank you very much. Matt, can you talk a little bit about the Team Toronto sprint strategy that was announced by yourself and the mayor a couple of days ago?
Yeah, absolutely. And I'm really excited about this. So this is our sprint strategy. It has been enabled. It's really the result of us receiving news from the province that we are expecting significantly increased amounts of vaccine. So there's a number of things that are happening. One is Toronto Public Health under the leadership of Dr. Davila, and they have taken the prioritization information and science data from the province of Ontario and have determined what the highest risk neighborhoods across our city are. And the sprint strategy does a couple of things. We're doing the best. Toronto Public Health is allocating as much vaccine as possible to get into those highest risk, highest exposure neighborhoods first. It doesn't mean that will be the only deployment. It just means that this really quick, heavy push into that to try and knock this fire out, if you will, this raging infernos of COVID that are happening in a number of our neighborhoods. The other thing that's happening as part of the sprint strategy, two things you may be interested in. because we're receiving more vaccine on, in the next couple of weeks. As of May the 10th, I'm excited to tell you we are expanding and increasing the capacity of a number of our city clinics, and that includes both the Scarborough Town Centre and Malvern. So we are increasing the number of doses that will be available in those clinics by 25%. They'll go up 25% each day. And the third thing we're doing is we're expanding our mobile clinic capabilities. And really in this, what we called Made in Toronto, by Toronto, for Toronto. And that is it's partnering Toronto paramedics and Toronto firefighters and building a bunch of different teams, additional teams who are able to go out in the field and work in a mobile capacity. So paramedics, of course, have higher levels of medical training and are able to actually administer vaccines. And we partner them with firefighters who are trained to do the registration, the screening, operate the COVAX reporting system, and do all of the aftercare and the medical assessment that happens after the immunization. So these are teams of trained, well-trained and equipped first responders that are going to let us roll much more vaccine out in the community much faster. And we're really excited. Those teams will be up and running as early as next week.
Thank you. That's very exciting. So, I mean, the message here is that structurally, we are structured and ready to go. We need the vaccine so we can get needles in the arms of the residents in Toronto. We have looked at the varying scenarios. We've looked at the relationship, the partnership. We know where the hotspots are. Mm-hmm. We just need the product in order to get it to the residents. That's the message that I'm hearing from you.
Absolutely correct, sir.
Yes, thank you. We need to also just to talk a little bit, Matt, if we could, in as much as we're talking vaccine, and that's the really important thing for us to obviously get right, so that we can get people protected against this scourge of a virus. We also need to remind people to, not gather in large groups, mm-hmm. to follow the emergency orders that are in place. To minimize their interaction with family members, as difficult as that is and has been for a long period of time for so many, to do their best to stay at home if they don't have to go out, they don't have to travel, to wash their hands, to wear their mask, and to do all the things that are necessary to keep themselves protected, protect everyone else around them, their family members. That is something that is not off the table. It's something that people have to continue to do. Would you just comment a little further on that?
Yeah, and you've hit arguably one of, if not the most important point. We know from medical science and experience that there's only one way that COVID spreads, and that is that it spreads from person to person. And the vaccine is a critically important piece, as you so well indicated. And really, on a go-forward basis, we will get to the point where every single person in the city that wishes to receive a vaccine will receive their vaccine. But in the meantime, we watch every day and we see the case counts rising and our hospitals are filling up, and there's just so much activity. The things that will control that is protecting physical distance, so keeping our distance, continuing to wear a mask, continuing to wash our hands, and continuing to avoid gathering in crowds. Exercise is great. The risk of transmission is lower outside. It is not zero outside, but of course the risk of transmission is lower outdoors than it is indoors. But the more we can do to keep our distance, to keep washing our hands, keep wearing our masks, and maintain compliance with all of those really hard, really frustrating public health measures. Those are the things that are going to protect our hospitals and our healthcare networks. It's going to prevent us from getting sick and from making other people sick. And in the meantime, we'll continue rolling vaccine out as very fast as we can.
Thank you for that. Chief, what have you been hearing with respect to some of the impacts that the stay-at-home orders and the challenge, obviously, dealing with a long period of time of people being at home and so on, particularly young people? Mm-hmm. I'm hearing things about issues relating to mental challenges, increase in terms of things like suicide and so on. I don't know if you've been hearing that as well, but I'm hearing that from some people. I'm just wondering what would be the message that you would sort of say to people in terms of talking and getting people to get their kids maybe to talk to the parents and maybe talk to others, and what are the things that you think that we could do to help in this area?
Yeah, really important topic. Thank you for raising this. There is no doubt that the impact that the public health measures and stay-at-home orders and physical distancing, there's a real toll that is paid by all, and certainly, and you listed some of those. I think all of us feel that, but I think absolutely really hard on children, really hard on some of the elderly, really hard on people that don't have a support network around them. So I think that the first thing is for all of us just to candidly, as you have done, sir, just to acknowledge that's true. This is really hard, and it's okay. It's okay for it to be really hard, and it's okay for us to be frustrated. Those are healthy, normal reactions and emotions to a very abnormal event. What I can say is there are some really good resources available to all of us. We've done our strategic communications group from the city has done a really wonderful job, along with Toronto Public Health, of pulling all of those things together on the toronto.ca/COVID-19 website. So there is a listing there of mental health and other health resources that are available both for children and adults. And I can tell you personally, this is something that's very important to me. It is really important that we take an active role for all of us in our mental health, and that means sometimes it's just about making an effort to pick the phone up and the phone or Zoom like we're doing and check in on our family and our friends and our loved ones and just make sure that people are doing okay. Sometimes that phone call or that friendly face on the screen means a lot, and not hesitating at all to reach out and ask for help from one of the resources if you're struggling. My message to everyone, and this is something that's become very, very important to me over my years as a first responder, is it is okay not to be okay. And reaching out and asking for help really and truly is a sign of strength. It is not a sign of being weak. When I see someone pick up the phone and reach out to one of the mental health resources, or a young child or a young person picks up the phone and phones a kids helpline, that's a sign of great strength. That's not weakness. So there are some great resources there. Know that I stand with you, because I do. I feel it too. This is hard on us all, and you have my word, Deputy Mayor, and to all of your residents and to everyone in the city. I'm going to be standing with you. I am not going to stop working and doing what I'm doing until this is behind us. In the meantime, we're going to get through this together. It's going to be hard. We can do this.
I do think that you're right, Chief, when you say that we all have to certainly stand together and work together. And this is a very difficult situation for everyone. Everyone is impacted by this. And I know that, some of my residents have said, look, and we talked a little bit about that earlier on, that, it seems that the distribution of the vaccine is not equitable. It may be equal, but not equitable. And that's a concern that some people have. So when we talk about numbers, for example, I'm going to put a graph up in a second, Chief. This graph is from the Scarborough Hospital Network, and it talks about the percentage of positivity at assessment centers for tests collected up to the 20th, which is basically a couple of days ago. And you can see that a few weeks ago it was around 15%, but now it's gone up to as high as 27% and going down to 24%. So when we talk about the challenges in areas in our community in Scarborough, we're actually basically using data and science to demonstrate what the impact is and so on. I'm not going to ask you to comment on that, but I would just ask you to comment on this issue of what is a concern for many about the inequity with respect to the distribution. And I know that it's something you control personally, but I wonder if you can speak to that, particularly when we talk about areas. Many of my residents are the ones going to work, taking the TTC, the ones that are at risk, the ones that come home to the families and so on. Then they have the potential possibility of spreading if they contract COVID-19, is spreading into the family because of the environment. And so this really speaks to the need to really focus our attention on putting the vaccines where it's needed the most, as opposed to just simply creating an equal distribution.
Mm-hmm. Yeah, absolutely. And that is precisely why the Toronto Public Health team, Dr. Davila's team, and her team of Associate Medical Officers of Health, that is why they have adopted a scientific data-based, so evidence-based approach. And the decisions that are being made, and that includes things like identifying right now the 13 hotspots across the city. Those have been identified on the basis of science. It is on the basis of demonstrated risk and risk of transmission and the highest rates of COVID-19 in our city. And it is on that basis that, under the authority of Dr. Davila, that is where vaccine is being prioritized. But I would, I think what equally matters is to know that doesn't end there. That is the sprint strategy, right? In my world, I would relate it to a major fire. We send a lot of resources to a big fire. We get that fire under control, and then we pull back and we move of course, back to the broader perspective. Very much the same. And really, and I know we kind of sound like a bit of a broken record here, but really, this is the answer is continuing, doing our very best to look after ourselves, and physical distancing, mask, hand washing, all of those things, stay-at-home order, as well as just, of course, what we're looking for. It is about more vaccine. The more vaccine we can get, the more vaccine we will deliver, the sooner that this will be behind us, and there's more vaccine coming. So I'm encouraged by that.
I'm very encouraged by your comment, Chief, and I hope that my residents are as well, because in as much as we are very concerned and some residents are extremely angry with respect to what they perceive as this inefficient system of rolling it out, not blaming you at all. We thank certainly you for your leadership. It is very important to recognize what is actually being done. In our community, we have 2 of the 13 of those hotspots. That's M1J and M1G. And I know that started today, there's work actually being done in terms of providing vaccination, the pop-up clinics in those particular areas. I just wanted to then ask you, there's a couple of questions, and I think that around, the closures of golf courses, and there is rumors, according to the question that's being asked here, that parks are going to be closed. Your comment first on golf courses, and then perhaps if you can maybe address, I have not heard that parks are going to be closed, but you may have heard something that I have not. So someone has asked that question. I'm just wondering if you can just touch on that.
I can. So let's start with parks. So parks are absolutely not closed. Parks are very much open. And I'll say all of these things. So the things that are closed are some of what we refer to as the amenities in some of the parks. So that is things like tennis courts and basketball courts and those types of things. The parks themselves are open. So they are open for exercise. They're open to be able to, to go out, to get some fresh air and to do all of those things. No indication that that's going to change. The golf course is being closed, and I will admit my bias because I enjoy hitting the golf ball like many do. Golf courses are closed. The reason golf courses are closed is because the province of Ontario issued an order ordering the closure of golf courses, not only in Toronto, but across the entire province. So it is, all of those closures are the result of provincial orders or legal orders and regulations passed by the province of Ontario, for which the City of Toronto has no choice but to comply. One of the questions we get, Deputy Mayor, is I know you're well aware, we're often asked, does the City of Toronto, could council, for example, override those orders? The answer to that is no. The municipal council, city council, does not have the legal authority to override a provincial order, and therefore our golf courses, our amenities outdoors are closed. The only way that that gets lifted is if the province of Ontario releases. So that's golf, that's tennis, that's basketball, that's many of those things. They're closed because we were ordered to close them, and we had no choice but to comply. So that's we went to work to close them.
Yeah, no, thank you very much for that, Chief. It has been a very difficult period, as we have already stated, and it sounds like a broken record, as you have stated earlier. But it is something that we have to work through. We have to do our best to help the residents and to work with the other levels of government, of course, with respect to the federal government who brings the vaccines in, the provincial government whose responsibility to distribute them. The city then is to distribute then to our partners as well as to our own systems. All of those measures are in place, and we are getting a lot of people now who are working to try to ensure that as best as we can, when we have the supplies, that we will get the needles in the arms to protect our residents. And that's the job one. That's our number one priority in terms of responding to COVID-19. We only have a few minutes left, and I wish we had all night, but I know you have to get on a call. I've got to get on an 8 o'clock call and so on. I've got to prepare for that. But I wanted just to ask, and I know there was just a quick pop-up here about, someone said, when will M1K get a pop-up clinic? And I'm not going to ask you that. I'm just going to simply say again, as we said earlier on, when the Scarborough Hospital Network and the program and the process that they have in place, when they have enough vaccines, we will see that they will roll out into those areas in order to try to get the pop-up clinics working along with all the other clinics. And the issue right now that we're facing is not enough vaccines that are available to put in people's arms. So we are at about, we've got about 3 minutes left. I'm going to give you about a minute just to your closing thoughts, and then I will wrap up, and we will wish everyone a great evening. So I'm going to turn it over to you, Matt, for your closing thoughts.
Sure. Well, thank you so much, and thank you, everyone. I appreciate the opportunity to answer the questions. I will end by saying this. We work very closely with the province. It is actually the province that determines eligibility, like we talked about, and that means the rules, if you will, the people that are eligible to go on to the online booking system or call the provincial booking system to book their appointment in city clinics. That's something determined by the province. We don't yet, I don't have the specifics, although here's a little teaser. I don't think it's going to be very long. Our sense is that the province, I think in due course, is going to expand that eligibility again so that more and more and more people are able to book their appointment and get their vaccine. So those are conversations we have with our provincial colleagues every single day. And I can tell you that Dr. Davila and I, as recently as this afternoon, we're in conversation with the province. So continue to watch toronto.ca/COVID-19. And of course, all of you on this call will get lifetime updates through Deputy Mayor and for all of our councillors across the city. But there are changes coming. You are going to see additional opportunities come both in city operated and hospital partners. That's going to come shortly, and look for that to expand relatively quickly and relatively frequently. Increases as we get into May and beyond. We all look forward to that. So thank you for the opportunity to be with you, sir.
Thank you very much, Matt. It's been very informative, and just thank you very much for your frankness, and thank you for your leadership, and thank you for all that you're doing. Please extend on behalf of myself and all the members of our community to all the team, all the members that you're working with and you're providing leadership. I just want to thank our residents for participating in tonight's event and to ask the questions that I've asked on your behalf. I want to remind you that for latest COVID-19 vaccine updates, please visit the City of Toronto's portal. The website is toronto.ca, as well as you can visit the province, which is ontario.ca, or the Canadian government website at canada.ca. I want to just remind residents to continue to do your utmost best, to stay alert, to be aware, to do all of the things that we need you to do, which is practicing social, physical distancing, washing your hands, doing all the things to stay basically safe, and encourage your family members to do that as well. I know that we have a lot of young kids now who are getting COVID-19 and so on, and the variants, quite frankly. And as I understand it, they're bypassing the emergency room and going basically straight to the ICU in many instances and so on. And that's a very scary thing. This is a very serious condition that we're facing. It's life or death in many cases, and we're doing the best we can to help you to get vaccinated and so on. So I will be providing additional updates. I don't have the date for the next meeting just yet, because as you see, this particular process is so fluid. Things change so quickly. We want to be able to provide you with the positive messages, and you know, which is what you need, which is what you're asking for, which is, when will I get my needle? That's what you want to know. And I will wait to have more information, and I will provide that that information when we have our next meeting. So Chief Pegg, thank you so much for participating with us this evening. I want to thank my staff team for helping me with respect to putting on this meeting. I want to thank everyone from the community. Stay safe, stay healthy. Thank you very much. Have a good night. Thank you.